But in all the case studies or case series where they talk about binge eating disorder, you hear this over and over: the noise, the food noise
Right.
decreased, the food noise
Mhm.
decreased.
Mhm.
I think food noise sometimes is the brain's desperate attempt to get energy by signaling hunger or signaling,
Mhm.
hey, we need some more energy.
Today, I'm so excited to chat with Nicole Laurent. She is a licensed mental health counselor, nonprofit founder of Brain Fog Recovery Source, and clinical innovator in metabolic psychiatry. Nicole specializes in the targeted use of ketogenic metabolic therapy to achieve remission in psychiatric disorders traditionally labeled treatment resistant. Through her clinical practice, peer-reviewed articles, influential blog, continuing education programs for psychotherapy professionals, and nonprofit initiatives, Nicole challenges conventional psychiatric paradigms and increases access to evidence-based ketogenic interventions for low-income and government-disabled populations globally. She reframes how mental health clinicians conceptualize and implement treatments, moving the field towards genuine remission and improved patient outcomes. Here's my conversation with Nicole. Hi, Nicole. Thank you so much for being here.
Thank you for having me. It's good to be here.
Absolutely. So, you've had an interesting path. So, you are actually a mental health clinician, and I understand that you actually started out with training in CBT and DBT and EMDR, and now you are a foremost expert in metabolic psychiatry and just all the work that you have put out. You just have to be so passionate about this. So, how did you start, sort of more in this cognitive sort of realm, and then now you're in this totally different realm and just really excelling? How did this shift happen?
Yeah, so I've been a licensed mental health counselor in Washington State for 18 years, doing what I feel like is really great therapies like EMDR, DBT, CBT. And I had a neurological condition in which I learned about ketogenic diets as a potential treatment. And so I did one, and my neurological condition got much better, much, much better very quickly. But what I really noticed was these really profound effects on mood. So I would not have ever considered myself anxious prior to my ketogenic diet. I had all the skills, all the DB. I knew my emotion
Right.
regulation tools. I knew my mindfulness. I mean, but when I experienced that kind of shift in my mood, I was like, oh, I've been working really hard all this time to regulate anxiety, and maybe it doesn't need to be this hard. Maybe it
Mm.
shouldn't be that hard.
Yeah.
And so that was a huge paradigm shift for me. And so then as I sat across from clients who were struggling and suffering, I began to think more and more about the metabolic effects, the metabolic pillar of a biopsychosocial model. And I began thinking about, oh man, would this person even be struggling in my office, every week if this piece was just in place? And so that made it really difficult for me to not talk about it with clients. And so, in order to continue to do ethical practice, I had to go and get additional training in nutrition and integrative health, and I got some certifications that for therapists that allowed me to talk about food and nutrition in general in session. And then, of course, I went and I got trained by some great epilepsy dietitians and some metabolic psychiatrists, and then I just implemented it into my practice. Here's what I saw, so I have this great kind of before and after experience with patients or with clients. So prior to using the metabolic pillar of a biopsychosocial model, the bio pillar, I think like many of the therapists listening to your podcast, my I would do great CBT, we would cognitively restructure, and then they would come back the next week or the next 2 weeks with the same kind of ingrained experience, and we would have to do it again, and we would have to do it again. And I would use my EMDR, and often they felt really a lot better after session. And sometimes we got to 0, the magical 0, right? Sometimes we only get to 1, but and then a few weeks later it would come back, and I was like, why does it not stick with everybody? Like, some people it would stick, don't get me wrong, these are good evidence-based therapies, but there was enough of my client population where I knew I was doing really well and I was doing it right, and it was not sticking. The benefits were not sticking. So, as you know, that can really contribute to burnout for
Yeah.
therapists. And
Yeah.
it's very frustrating to clients, because clients are always like, I must not be doing something right, when really that might not be the case at all.
Yeah.
And so then once I had this experience and I started implementing this into my work, what I found is that when we support that metabolic piece in our bio pillar of our biopsychosocial model, my therapy tools worked so much better. We got to zero, we stayed to zero with the EMDR.
Yeah.
We restructured something cognitively, it stuck. And sometimes they didn't even have the thinking distortion at all, the cognitive distortion in the first place, because it
Mhm,
just
mhm.
really changes profoundly neurotransmitter balance. It affects many different pieces to have a healthy metabolic pillar in your biopsychosocial model. So I see, when I went to graduate school and I thought, I'm going to help everybody self actualize, I'm going to help them, really feel good and really feel great about their life and have fantastic relationships with their partners and their children and their coworkers, and it's going to be fantastic. And that was not kind of what I was doing, even though I was trying really hard prior to this.
Mhm.
But after this, the ketogenic diet is really kind of the promise that we were told about medication. So many, many years ago, when I was in graduate school, we were told that if you put someone on medications before CBT or with other psychotherapies, that their brain would work just a little bit better and that
Mm,
you would get
mhm.
better psychotherapy results because of it. Well, I did not see that in my practice. And I don't know if all your listeners saw that, but I feel like a lot of us did not see that promise. But I do see that promise when I do a ketogenic diet with someone and then implement psychotherapy. So that's a little bit about where I was and where I'm at now.
Thank you for sharing that story. I didn't know that. So thank you for sharing. And I just like commend you for just continuing to push and being like, I'm doing the best I can. And I know I'm doing the best I can. I know my clients are doing the best I can, but I feel like there's something more that I could offer, and for you to pursue the training, and to just keep going and note that there is a distinct difference in the before and afters. It's just amazing. For people who don't know as much about, I mean, I'm completely convinced about ketogenic therapies for mental health, but for people who are more unfamiliar and maybe just think like, what is the keto? They think a keto is something they saw on Instagram. What's the difference between like keto that someone might see on Instagram or TikTok versus the ketogenic therapies that you do? And they might think, oh, this is related to weight loss, or so that's within their head right now. But how do you distinguish that? And how would you explain to them sort of like the basic mechanisms on how this is different and how this can help treat, mental illness and neurological conditions?
Gosh, that's a big question. I might be talking for a really long time. So
You could do like a
like
basic,
a basic.
yeah.
So yes, ketogenic diet is used for weight loss quite effectively. And someone who is doing the ketogenic diet for weight loss might actually get profound mental health benefits just doing it that way. And in fact, there's published case studies in schizophrenia, for example, where patients have went off to a weight loss clinic and been put on a ketogenic diet for weight loss because the psychiatric medications have such profound weight gain effects and metabolic disruptions, and they went into remission from schizophrenia because
Wow.
they just did a ketogenic diet for weight loss. And that's not a super exact thing. It's just, very, very low carb, or choosing foods that are low carb and eating moderate amounts of protein, and or sometimes even higher protein, and maybe or maybe not eating a ton of fat, because sometimes when people have weight to lose, they're able to access their own body stores for ketone production. So you can do a ketogenic diet willy-nilly for weight loss and not track things and get really kind of great benefits. So, but I'm trained from the epilepsy world, and the way I do ketogenic diets for mental illness is very, a little bit more exact. So, and the reason we do this is, there's very specific types of ketogenic diet ratios that we use for, different age groups, and everybody makes ketones at different levels. Some people need to eat fat to make ketones. Some people don't need to eat as much fat. And so it's more particular. So when someone comes to see me, they're often on a ketogenic diet or a low carb diet, and they're not getting the results that they're looking for or we're expecting. And so
Yeah.
then when they come to me, we track food, which is great because then I can see what their protein, fat, and carbohydrates are per meal. We track ketones, we track blood glucose. We add in other metabolic psychiatry interventions like light exposure, exercise, sleep hygiene, meal timing, things like that. So ketogenic diets are where we switch the fuel source over to primarily fat for fuel, fatty acids that you either eat or burn off of your body fat. The body will then turn those fatty acids into something called ketone bodies. And ketone bodies are this brilliant neural network stabilizing fuel for the brain. And as early as people's 30s, they can start to utilize glucose less efficiently as a brain fuel. And so
Mm,
then it starts this process of the brain is hungry for energy. The brain can't do basic housekeeping. The brain can't maintain an environment in which to make its neurotransmitters in the right ratios, or there's more neuroinflammation. So the neurotransmitter sensitivity goes down. Like there's all these ramifications to the brain not having the energy it needs to do its thing and to maintain its housekeeping, as I call it. We see it in the 30s, but really there's been research showing that between the ages of 40 and 60, that glucose, the ability to use glucose as a brain fuel goes down significantly. So there really is much benefit to considering moving to a lower carb or even a ketogenic diet as we age.
I imagine that there are people who feel like, okay, yes, I'm on board, I want to do this, but a huge hurdle is actually being able to consistently adhere to the diet as needed. So how do you help your clients overcome these hurdles?
I hear that a lot, and that makes sense intuitively that this would be a really, really hard thing to do for any amount of time. And particularly in populations with serious mental illness, that seems like an intuitive no-brainer, right? A given. But that's not what the research literature is showing at all. So there's been studies coming out of Edinburgh and Stanford University, even college population. People in dorms having to eat out of dorm halls and, trying to figure out how to eat and having all that social pressure. We're actually seeing that people can and do adhere to it without too much problem. They also are really great at testing their ketones. So not only are they adhering to the diet, but they're also testing their ketones and their glucose regularly on top of it. And this is also in serious mental illness. So this is treatment, this is depression, bipolar disorder, and schizophrenia. All of these populations have been tested for feasibility, safety, and adherence.
Hmm.
And it's doable. It's quite doable. And I think that part of the thing is that people start to feel treatment benefits, and then they're very motivated because
Hmm.
they are tired of feeling sick. They are tired of chronic illness, and they are tired of this kind of low functioning or oftentimes low functioning existence. And so when they start to feel better, imagine the behavioral modification that's
Right.
going on
Right.
there. So I would not say that people cannot adhere to it. I've been on a ketogenic diet for 8 years for my neurological condition because I feel so much better on it.
Mhm.
And there's been moments, where I've gone off of it, here or there. But I go right back on because I feel so much better on it and my brain just works so much better on it. And I would say, when we talk about medications in psychiatry and psychology, there's this idea that a diet or a ketogenic diet or we call it ketogenic metabolic therapy often now in psychiatry anyways. And that, this is unsustainable. It's unsustainable. Well, is medication unsustainable? Because people go off of
Mhm.
that all the time because the side
Mhm.
effects are debilitating. So, do we call medications unsustainable because there's times when people go off of their medications? No, we don't. But we
Mhm.
do we do try to say that about the ketogenic diet. So I'm just kind of not buying that so much.
I love hearing that with the clients you work with, adherence is not really an issue. About how long does it take for people to notice a difference in general?
Yeah, that varies so much. So you do get those people, like I noticed a difference 4 days in. So it was only 4 days and I was like, ooh, something is happening. I feel like you hear people say this. I feel like the lights came on, like the lights came on in my brain. And you hear that with, psychiatric populations. Sometimes it's 4 days, sometimes it's 2 weeks. Sometimes it's 6 weeks.
Hmm.
Sometimes it is 7 months. And sometimes there are confounding variables with medications where the medication side effects are such that it makes it a little bit difficult to kind of tell if you're getting benefit.
Hmm.
Sometimes medications need to be adjusted down as people do better, and then they can kind of really feel the effects a little bit more.
You recently, in June, you and Dr. Erin Bellamy came out with an amazing groundbreaking paper called Transdiagnostic Remission of Psychiatric Comorbidity and Post-Traumatic Stress Disorder, ADHD, and Binge Eating Disorder using ketogenic metabolic therapy, a retrospective case report. That is a mouthful, but
I know. It was a hard
if
thing to title. There was a lot going on in that paper. We had
right.
to like make sure it was all said.
Yeah, no, I mean, it's amazing, amazing paper. I was wondering if you could share some of the amazing results, especially as it related to the binge eating disorder.
Every time you see a case study published, in many fields, case studies are about unusual single experiences, right?
Hmm.
Like a doctor will publish a case study because, ooh, this person recovered really well, and we don't usually see that. And the reason Aaron and I and some other people that I co-author case studies so much is that in our experience, we see these kinds of recoveries all the time. But we understand that it's important to publish these case studies in the peer-reviewed literature because other practitioners who are not using this modality are not seeing it and they do not think it is possible. In
Right.
fact, hopefully Aaron won't be upset I'm sharing this. In fact, there was when Aaron posted her, so that was her person um that she treated. When she
Hmm.
posted that on LinkedIn, someone in the comments said, this, how did he say that? He said something like, this is unlikely, like suggesting that somehow Aaron had made this up, or that, this was some kind of ketogenic scam. I don't know what he was inferring. It went through peer review, and I assure you, myself and Aaron and other people, we are not making these things up. But yes, so again, it's important to publish case studies. So this was a beautiful recovery, and it's what I see also in binge eating disorder. This person had, I believe it was 7 diagnoses, and that's what we see in practice, right? We don't see people walk in the door with one diagnosis very often, although I've had a few. And that the reason we pointed out the transdiagnostic nature of the recovery with a ketogenic diet was because there was a paper where they finally used the word transdiagnostic. Like, look, this is helping people with schizophrenia and bipolar disorder. And there's evidence showing that it's helping potentially with eating disorders. And, so that's transdiagnostic. And I thought, well, that's a really important thing to point out in the research literature with that. I see that too with binge eating disorder. I have a whole theory about why that is. I think that when you're so yes, there's an addictive nature to ultra processed foods, most certainly, and that is a piece that drives binge eating disorders. But I also think that those foods impair brain metabolism in such a way that the frontal lobe does not function very well for impulse control.
Yeah.
So if my frontal lobe is not well fueled and I have an impulse or an urge to do something, I really don't have the brakes to
Hmm.
say to myself, that might not be what I want long term, or that's just going to
Right.
make me hungry later, or that's not
Hmm.
that's not going to fuel my brain. You just don't kind of have that. And I think when you do binge eating disorder work with ketogenic diets, for many people, not everybody, but for many people, if they get their ketone levels up a little bit higher, they have better treatment effects. And I think part of it is an improvement in frontal lobe function and a much easier time saying no to things. Now,
Hmm.
there's also the piece that's been not validated is not the right word because we don't have our clinical trials in this yet, but I'm sure they're coming, or there's probably 2 going on right now that I don't even know about. But in all the case studies or case series where they talk about binge eating disorder, you hear this over and over: the food noise
Right.
decreased, the food noise
Hmm.
decreased.
Hmm.
I think food noise sometimes is the brain's desperate attempt to get energy.
Mm.
signaling hunger or signaling,
Mhm.
hey, we need some more energy. Here's the
Right.
foods you're used to eating. So
Mhm.
I think that improves on a ketogenic diet. And that's been in several case series and case studies. And so I think there's definitely something to, I know there's something to a ketogenic diet that can really help with binge eating disorder.
When with your work with the clients that you have that have successfully reduced the food noise in loss of control eating situations, like you said, ketones a little bit higher, then kind of like what's the range that you might try to target at first?
Yeah, and that's the thing. I hesitate to give a range because we don't have the clinical studies that say we have the best treatment effects for this. And sometimes they don't really even need very high ranges. Like,
Mhm.
nutritional ketosis is confirmed at zero point 0.5 millimoles of BHB.
Mhm.
And some people, the food noise goes away just right down there, right down at that
Mhm.
level. But as you read in Erin's case study, that person felt better treatment effects at higher levels. And so usually
Mhm.
the range is between 1.5 and 3.
Mhm.
Um, and sometimes people drop to 1, and that's great and that's okay. But yeah, the kind of the therapeutic range we're seeing is a 1.5 to 3 range for people, sometimes 4 and higher, but
Mhm.
not super high. Like most adults, or a lot of adults, they work really hard and they do their ketogenic diet right, and they're sufficient in what they need to make ketones, but they don't get above a 2 or whatever. So I don't want anybody listening to be like, "Oh my gosh, I can't get to 4, so I'm not going to, treat my binge eating disorder." That's not how it works.
Mhm.
So anyways, 1.5 to 3 is kind of the range we tell people to try to get to.
Mhm. Do you still track your ketones nowadays?
So the average amount of time people tend to track their ketones is about 3 months. Some people do it longer and more often. Once you kind of get an idea of what your plate needs to look like, or you want it to look like to kind of meet your ratios, you can just kind of stop tracking. You know how you feel.
Yeah.
If you don't feel good, you might test. If you feel really good, you might test. Be
Yeah.
curious about what ketone level you're at. But yeah, no, I don't anymore. But if I was struggling, I would certainly take out my Keto Mojo and start tracking again and get back on track and figure out what's going on.
What are the misconceptions about keto for mental health that you wish you could debunk once and for all?
There's so many. It's so interesting. Anytime you go into the realm of food, people have very deep belief systems about how they eat, or how they think people should eat, or what
True.
they think people should eat morally because of the planet, or because, whatever. So food is very almost like a religion with people without them even being able to articulate why, or that is the case. And so anytime you put some kind of paradigm forward that says, hey, you maybe should eat this way, everybody starts to protect, right? And I don't eat that way, and I don't eat it that way because of this is an issue, or this is
Mhm.
this is how it is. And so you get a lot of misunderstandings about ketogenic diets. So I'm going to turn that around to you, is like, what are the ones you hear? And I'll tell you what I teach therapists about it who might have biases in session that they need to keep under wraps.
Well, like all the stuff like you shouldn't eat saturated fat, you shouldn't eat red meat, all that stuff is really bad for you. It's, leading to you need to get on statins, it's
Oh
gonna
my
raise your
gosh.
blood
Oh
pressure,
my gosh.
just like it's not healthy.
Nobody trying to heal your brain should be on a statin. Nobody trying to heal their brain or with a psychiatric illness, I believe, should be on a statin. Not a medical provider, don't care. I'm going to say it anyways, because statins will steal the cholesterol right out of your brain that your brain is trying to make to maintain your brain. They cause huge amounts of insulin resistance. They set people up for prediabetes and diabetes, which is a metabolic disorder. And as Chris Palmer has said, and many people now have said, that mental illness has metabolic roots, and so nobody trying to heal their brain should be on a statin. Saturated fat, there was just a big meta-analysis on RCTs that was published in 2025 that said it's not a valid concern. It's not a scientific based concern. The cardiologists have been told since I believe 2016 or 2017 to stop using an LDL as a reason by itself to suggest statins. They will not stop. And I get quite pesky about this because I get people with serious mental illness who could achieve remission being scared off from ketogenic diets by cardiologists that will not keep up with the literature. So I'm a little frustrated with that. As psychotherapists, we are supposed to be evidence-based in our practice. What I think we have failed at terribly in nutrition and possibly in our training programs is an understanding that epidemiological data is not scientific evidence really for anything. It is a method that is used to generate theory that needs to then be tested. We've been, and the media is part of this. They have been talking about, oh, there's an association with this and this and this and this. So there's no association with meat. I mean, if you're like, I refuse to listen to RCTs and I refuse clinical data and pilot trials, and I'm going to make all my decisions on epidemiological data, you would actually see other studies with that same methodology, such as it is, that show that elderly people who have more red meat live longer and have a better health span. So, and that elderly people with higher cholesterol live longer. There's immune effects. There's beneficial immune effects to having a higher LDL when you are older. This is in that data too. So again, if we're going to be evidence-based in our psychology work or our counseling work, we really have to get much more critical about where we get our data and use our own noggin in order to actually evaluate it. And if you don't know the difference between epidemiological data and clinical trials and RCTs, it's just time to, go on Google and just do a refresher and start to understand that there are levels of evidence. Now, levels of evidence, RCTs are not the only way to know something. But I would say it is an ethical issue if you are warning someone away from a ketogenic diet who could benefit with serious mental illness, where in serious mental illness, the suicide rates are very high, and you've warned them off of doing a ketogenic diet when they could have achieved remission or a huge benefit in symptoms based on terrible epidemiological data around fears around cholesterol and red meat, that is unethical.
Yeah. One of the things that, since you're debunking and refuting challenges, one of the things that I think some people think about a ketogenic diet in the context of helping recovery from binge eating or bulimia or anorexia, for that matter, food addiction, ultra processed food use disorder, and so forth, they might think, oh, well, this will cause like more disordered behavior, which I totally don't agree with, but I'm gonna give you the floor so that you can share your thoughts on that statement.
Yeah. So I train psychotherapists on how to support individuals using ketogenic diets. And that is one of the things that we talk about in great detail. We go through the research literature around this topic and around the topic of ultra processed foods, what the effects are. Psychology and counseling can often be in a research silo. And so there is a tendency to focus more on the psycho and social pillars of practice and ignore the bio pillar, feeling like we really don't, we don't work in that. And so I think that is an ethical practice. So in my training, we talk about the research literature and how there really is a neuroendocrine and a neurobiological piece to eating disorders that you cannot ignore and just focus on the psychological and the social components. Again, if you're going to ignore a whole silo of research literature and only focus on a psycho pillar and a social pillar of practice, that is not a biopsychosocial model of practice. And, I was trained many, many years ago where you have to keep that in mind as ethical practice.
Thank you so much for responding to that. Looking ahead in the next 10 years or so, where do you see the future of metabolic psychiatry?
Well, I think it's inevitable that it will eventually become offered as standard of care. And I know that there's a lot of people that are quite pessimistic about it. They're like, "Oh no, big pharma won't allow that," or
Mm,
they're quite pessimistic about it. But I think that as people see others recover and not just have symptom reduction or control, but actually thrive, they want a piece of that. They really do. They see their neighbor do it. They see their husband do it. They see, like, I think that the stories coming out of metabolic psychiatry and the different nonprofit organizations work to make those public and available and seeable is going to increase demand for this as a potential treatment. Uh, yeah, as a wonderful treatment. It really is. We don't have treatments like this. We do not have things for brains in a pill bottle that the ketogenic diet can do. I just really want people to understand that. So ketogenic diets have been used to heal brains in epilepsy for over 100 years. And why do I say heal brains? Because sometimes people with epilepsy can do a ketogenic diet for 1 to 5 years and then eat normally, which would suggest that something has been healed. Yes? We
Mm-hmm.
don't have pills that do that. I promise you, there is not something that your prescriber can put on a prescription pad that you can pick up at the drugstore that is going to do the same thing.
Mm-hmm.
So people have an innate wish for healing. And when they see people getting it this way, I think they're going to ask for it. I think they're going to demand it from the medical establishment. And as demand goes up, I think the medical establishment is going to find ways to give people access to it. Because otherwise, they're going to go off and find someone like me and create a treatment team and get it done without them. I see, there's lots of people getting well outside of the medical system using this treatment. I pull together treatment teams, or I have people do that. So they'll work with a dietary professional like me. They'll maybe have a psychotherapist,
Mm-hmm.
and then they'll have a medical provider to oversee the medical component, potentially monitor their blood work and
Mm-hmm.
reduce or adjust medications as needed. And
Mm-hmm.
that's all they do. They don't need a big hospital
Right.
necessarily. They don't need an inpatient unit, although there are people who I'm excited about someday this being offered in an inpatient unit. Um,
Absolutely.
that's coming someday, I think. So yes, I'm very optimistic, and I know that this healing is going to be available to people one way or another. And I think the medical system is going to have to get on board, or it's just going to kind of be left behind around this.
I completely agree. It's very exciting. I understand that you offer trainings. You also offer services for clients as well. I'm wondering if you could tell us about the clients you have for the service you have for clients, as well as what support that you can offer for non-medicine
Yeah.
for providers to learn more about metabolic therapies.
Yes, metabolicmind.org is a fantastic organization, and they do a great job. They have so many wonderful evidence-based resources on their website. They also have this really cool section where you can see the research that's already been published and the research currently going on all over the world around this, with links to the studies that have been published, which is really helpful. Nice to have it all in one place.
Yeah.
They also have links to different practitioners like me that people can explore to put a treatment team together, most certainly. I have an online program that I've been doing since 2022 and gotten great results. In fact, at least one of my case studies that I have published. So online programs can actually be very helpful if they're well set up. And so yeah, my online program is great. It's got 2 live Q&As a week, where people can submit questions, and that is really lovely because it provides a kind of a peer support community as well.
Mhm.
Which I think when people are adjusting to this, it can feel very lonely because you're kind of the only person at the restaurant not eating the bread, right? So, but if
Right.
you are coming on a live Q&A and you're seeing, 30 people who also are not eating the bread, that really kind of helps you. And it's got a functional nutrition component to the program. We put them on a medical ketogenic diet. They learn how to self-advocate with their treatment providers. And we work on the implementation of all the other metabolic psychiatry pieces. So I love my program, and many of the people in my program love my program. And it really is the fastest, best way to meet with me. So I do have a very limited individual consultation,
Okay.
and I think the piece of the program is superior in most cases.
I know that you have a metabolic psychiatry for non-prescribers
Non-prescribers, yeah.
coming up.
Yeah, so that is specifically a training for psychotherapists, and it teaches them how to support a individual on a ketogenic diet. So when someone comes in for questions, how to give evidence-based answers, how to manage transference or countertransference that comes on. So it really is a psychotherapy type of training. We do case studies and we talk about how to use existing psychotherapy modalities as a support for someone who's trying to make the lifestyle implementations that they need that might save their life or their quality of life. It really is, and we talk about ethics and professional roles. So it's quite comprehensive. It doesn't teach them how to initiate or monitor it. That's the job of the nutritionist or the dietitian on the treatment team. But I've gotten really good feedback about psychotherapists feeling exponentially more prepared to be able to support an individual who's trying to use metabolic psychiatry interventions.
That's so wonderful. If people check out your website, there's a lot of resources there as well. So I encourage everyone to check it out. I'll be sure to include that in the episode description. And just thank you so much for the amazing work that you do. And thank you so much for sharing your time and your experience and your wisdom with us. So thank you so much, Nicole.
Oh, you're so welcome. It's been great to be here. Thank you for having me.